Emma Lubitch, and you're watching CAN TV. We're here today with Fred Tsao of the Illinois Coalition for Immigrant and Refugee Rights to discuss the impacts that the COVID-19 crisis is having on refugee and immigrant communities in Chicago and across the state. So thank you so much for being with us today, Fred. Can you just give us a background of the work that ICER does?
Sure. So the Illinois Coalition for Immigrant and Refugee Rights, ICER, is the state's largest multi-ethnic immigrant advocacy organization. We've been around since 1986. We have more than 100 members and allies across the state, representing the vast diversity, both geographically and ethnically and in terms of national origin, of Chicago's or Illinois' immigrant and refugee communities. Much of our work is focused on advocacy and policy development, but we also run several programs, including a couple programs funded by the state on citizenship and language access. We also do a lot of public education, outreach. We run a family support hotline where people can call to report incidents of ICE enforcement or just get information about any number of different topics. And we are also, because this is a census year, we're also in the midst of doing a lot of census outreach. And we also regularly do voter engagement and voter registration work. And this is, after all, a very significant election year as well. So we cover a lot of different areas.
How, in the midst then of this crisis, are immigrant refugee communities kind of disproportionately being affected?
Immigrants and refugees, unfortunately, are, very often people working on the front lines. We're somewhat overrepresented among certain industries, including, agriculture, food processing, food service, grocery workers, as well on the other end of the spectrum in healthcare areas, doctors, nurses, other care providers. Also, immigrants and refugees tend to own small businesses, and many of those small businesses, unfortunately, have had to close or have had to scale way down on their operations in the wake of the pandemic and the stay-at-home orders. So so there have been a number of different impacts, and then on top of all of that, unfortunately, the federal relief that has been extended to many of us throughout the country is off limits to many immigrant families, in particular the IRS payments, the $1,200 per person tax payments are not available to people who did not use the Social Security number to file their taxes, or may have filed jointly with somebody who did not use a Social Security number, or for that matter, may have someone who does not have a Social Security number in their household. And then on top of that, undocumented immigrants in particular are not eligible for unemployment. So if they lose their job, they're not, unlike many of the rest of us, they're not going to be able to file for unemployment insurance. So, that has meant that, immigrants and refugees, unfortunately, have borne a lot of the brunt of the major impacts, whether it's losing work or being on the front line and putting themselves at risk, or just not being eligible for many of the safety nets that have been extended.
Right. So I know that ICER just came out with a policy platform that is COVID-19 specific. So can you just kind of elaborate on that a little bit for us?
Sure. So back in March, we worked with many of our member organizations and allies to assemble a platform called Everybody In. And this is meant to be not just a set of measures that we can advocate for in the short term, but also a vision of where we want to be as a society. Let's not look just at immediate relief, as important as that is, but also let's look at some of the underlying inequities that really need to be addressed for us to be a more inclusive and more compassionate and more humane society. So there are four main components of the platform. One is healthcare access for all, and unfortunately, even for many immigrants, not even healthcare coverage for COVID treatment is available. They're not included in Medicaid or some other healthcare coverage programs. And information regarding, healthcare, information just about the coronavirus, not to mention other, available healthcare services is either just not available, or it's available but not in the right language and not in a way that can be easily understood or culturally appropriate. So we want to make sure that all of those aspects are available to immigrants and refugees. The second is economic security for all. So getting beyond healthcare issues, obviously, the pandemic has had a devastating impact, as I described earlier, on immigrants and refugees economically. So what can we be doing to enable immigrants and refugees to get many of the same supports that are available to many of the rest of us, and whether that's cash payments or unemployment benefits, or housing support, or protections in the workplace, or other things that that many of the rest of us enjoy. So again, we want to look not just to immediate relief, but also broader inequities. And then the other two planks have more to do with immigration enforcement and incarceration. Immigration detention facilities, unfortunately, have become hotbeds of pandemic spread. And so what we want to do, what we're advocating for, is releasing safely into the community many of the people who are at risk in immigration detention, and in criminal custody as well. Many of the people who are being detained or who are incarcerated could probably be safely released into the community, posing no threats to our public safety. Yet they are at risk while they remain in jail, or remain in prison, or remain in immigration detention. So, let's see what we can do to try to, release people safely and no longer put them in risk. And then the flip side of that, which is the fourth plank, is keeping people out of these facilities by, putting a pause on immigration enforcement and many of the over-policing policies that otherwise could land people in jail, or could land people in immigration detention. Let's try to uphold public safety, but do so in a way that protects the safety of those who could otherwise be put at risk by landing in jail or landing in immigration detention. So those are the four main pillars. We've run a couple of action days already to advocate for pieces of this platform. We're continuing to advocate on all levels of government, federal, state, and local, to try to win broader solutions, immediate relief, but also broader solutions for immigrants and refugees, so that nobody is left out, so that everybody is in.
Yeah, absolutely.
Mm-hmm.
And so how then does this crisis kind of, because I know you guys do a lot of work for the census, and we do, as you said, have an upcoming election. So is that work kind of taking a back seat, or are you guys just trying to figure out the best way to advocate for that in these times?
Yeah, well, speaking to the census in particular, obviously the census is incredibly important, and the census day, April 1st, you know, passed during the stay-at-home orders. Fortunately, Illinois is one of the higher responding states in the country, but we also know that many neighborhoods, many census tracts that have significant immigrant populations have not responded as well as much of the rest of the state. And so we want to make sure that those communities are counted as well. Obviously we cannot go door to door to ask people to respond to the census. What we can do though is, phone bank. We can use social media. We can, use other digital tools to try to publicize the census and get people to respond. Today actually is not just Cinco de Mayo, but also Census de Mayo. So we are trying to use this day as an occasion to promote census turnout, and we will continue to do that. Fortunately, it looks like many of the deadlines that we have been facing are going to be extended. So we will have time to do the outreach and do the education that we need to do to make sure that people in our communities fill out the forms, go online and answer the questionnaires, or otherwise mail in the forms and get themselves counted.
Yeah, well, that's great that you guys are still doing that work. Do you have any resources or places that you can point people to where undocumented people in Chicago could safely seek out medical resources?
Yes, indeed. So on our website, icrr.org, there is a community resources page, which is just icrr.org/community-resources. And that page has links to resources on a number of different topics, not the least of which being a guide that many of my colleagues put together to that offers lists of resources on any number of different topics, financial assistance, food, shelter, medical assistance, and the like. This guide is a Google Doc, so it's a work in progress. If we get new information, we will add it in and upload it. On top of that, we are also, trying to promote other resources that are available. The city of Chicago has made a couple of funds available for small businesses and for rental assistance. Governor Pritzker has recruited his sister to also raise funds to provide help for people throughout the state who are facing struggles, in the wake of the pandemic. We're always pushing for more resources to be available to people in the community, and hopefully there'll be more news, more information to be shared in the days to come.
Yeah, absolutely. Well, thank you so much for talking with us today, and obviously appreciate all the great work that you're doing in the community.
Okay. Thank you, Emma. Anytime.